Hello YouTube, I am Dr. Robiul. I work as a lecturer in pathology in a medical college hospital, and I am making this video for my students and also for you. Hope someone finds this helpful. Today's topic is emphysema. In this video, first we will try to define emphysema, then we will discuss its causes, types, pathogenesis, clinical features, diagnosis, and treatment. Okay, so let's begin. First question, what is emphysema? Emphysema can be defined as a condition of the lungs characterized by irreversible enlargement of the air spaces distal to the terminal bronchioles, accompanied by destruction of its wall without any obvious fibrosis. Okay, so I hope you're still with me. You didn't run away just like my students do when I try to teach them definitions of pathology. I even have to show them teddy bears. So look, I am showing you teddy bear also. So don't get scared because I will explain this definition line by line. Okay, so what did I say in the first line? Emphysema is a condition of the lungs characterized by irreversible, that means permanent, enlargement of the air spaces. And where does this enlargement take place? This enlargement of the air space is occurring distal to the terminal bronchioles. Recall from your anatomy classes, we can divide lungs into two zones. They are the conducting zone and respiratory zone anatomically. And in the conducting zone, we had bronchi, then we had bronchioles up to terminal bronchiole. And beyond terminal bronchiole, the remaining part of the respiratory tree was called the respiratory zone, and they contained the respiratory bronchiole, alveolar duct, alveolar sac, and alveoli. And in emphysema, the part that is distal to the terminal bronchiole, that part is getting permanently enlarged. That air space is getting permanently enlarged. Okay, so as you can see, I have also drawn an image of lungs here. This is a very simple image, diagrammatic image. I am sure you know that trachea divides into right and left bronchi. So this is the right bronchi, this is the left bronchi, and then they enter into corresponding lungs. And inside the lungs, they further divide into smaller and smaller and smaller tubular structures, which are known as bronchioles. And you can also see that I have zoomed into this part of the respiratory tree and I have drawn it here. So this is the end of the terminal bronchiole, and beyond terminal bronchiole in a normal lungs we will have respiratory bronchiole. So my finger is now just over the respiratory bronchiole, and we will also have alveolar duct, alveolar sac, and inside the saccular structure we will have alveoli where we will have gaseous exchange. In fact, gaseous exchange will occur in the entire respiratory zone. Okay, and in case of emphysema, that part is getting irreversibly or permanently enlarged. So now that we have defined emphysema and explained the definition, now we will move on to the next topic, and that is the cause of emphysema. The most common cause of emphysema is tobacco smoke and congenital alpha-1 antitrypsin deficiency, and we will discuss about them further when we will talk about the pathogenesis. So for the moment, just remember, causes of emphysema include smoking, that's the number one cause of emphysema, and it also includes alpha-1 antitrypsin deficiency. So now that we have defined emphysema and mentioned its most important causes. Now we will move on to the next topic and discuss the classification of emphysema. What are the types of emphysema? So we can classify emphysema according to its anatomical distribution. There are in fact 4 types of emphysema. They include Centriacinar, Panacinar, Paraseptal, which is also known as Distal Acinar, and Irregular type of emphysema. And always remember the first two, the Centriacinar and Panacinar, they are clinically important, but the remaining two, the Distal Acinar and Irregular, they are less important because they are asymptomatic in most of the cases. So the most common variety of emphysema is the Centriacinar type of emphysema. 95% cases of emphysema are the Centriacinar variety. Now what do we mean by Centriacinar emphysema? To understand that, first we have to know what do we mean by acinas. So in case of the respiratory system, respiratory acini contains respiratory bronchiole, alveolar duct, alveolar sac and alveoli. Okay, so this is a respiratory acini. And in Centriacinar emphysema, the central part of the respiratory acini get affected. There is emphysema in the central part of the respiratory acini. And if I want to be more clear, there is emphysema in the respiratory bronchiole. Okay, so this is the respiratory bronchiole. So in Centriacinar emphysema, the affected part will be the respiratory bronchiole, as we can see here. So this is the image of Centriacinar emphysema. This is the diagrammatic image, and as you can see, this is the terminal bronchiole, and that enlargement is happening beyond the terminal bronchiole. So by definition it is no doubt emphysema, but emphysema here is occurring only in the respiratory bronchiole. Look at the alveolar duct or the alveolar sac. They look normal. So this is Centriacinar emphysema. Only the central part of the respiratory acini was involved in this type of emphysema. And one important thing you have to know, that Centriacinar type of emphysema usually happens in the upper portion of the lung or in the apical region of the lung. The Centriacinar emphysema occurs predominantly in heavy smokers. Regarding the Panacinar type of emphysema, it occurs in the entire respiratory acini. As you can see in the image, this is the terminal bronchiole, this is the part beyond the terminal bronchiole. That means this should be the respiratory acini, and as you can see here, the entire respiratory acini, that means the respiratory bronchiole, the alveolar duct, the alveolar sac, alveoli, all these structures are irreversibly enlarged, and that is meant by Panacinar emphysema. And one important thing you have to know, in contrast to the Centriacinar emphysema, Panacinar emphysema occurs in the lower part of the lungs and in the anterior margin. And in the severe cases of Panacinar emphysema, it is commonly seen in the base of the lungs. Okay, so that is in short about Panacinar emphysema. Regarding the Distal Acinar emphysema, which is also known as Paraseptal emphysema, in this variety, the central portion, that is the respiratory bronchiole of the respiratory acini, is normal. Okay, so this zone will be normal in the Distal Acinar type of emphysema. However, the distal part, that means these areas, will be affected. It is most striking near the pleura or near the margin of the lobules and septums of the alveoli. Okay, so that is in short about distal acinar or paraseptal emphysema. And one important thing that you have to know, sometimes those paraseptal or distal acinar emphysematous blebs, they sometimes rupture, and that can lead to pneumothorax. Okay, so always keep that in your mind. And regarding the last variety of emphysema, it is irregular type of emphysema, and it usually seen in areas of scarring. Okay, so this is in short about the 4 types of emphysema. So now that we have discussed the definition, cause and type of emphysema, now we will move on to the next topic and discuss how emphysema is developing, or what is the pathogenesis of emphysema. Emphysema develops when there is imbalance between anti-elastase and elastase, and when there is imbalance between antioxidants and oxidants. So whenever there is increased amount of elastase and increased amount of oxidants, that will damage the elastic tissue around the small airways, and that will result in emphysema. To understand the pathogenesis further, we have to know the function of the elastic tissues that are located in the outside wall of the small airways. So as you can see, drawn in the blue, these are the elastic tissues located on the outside wall of the small airways. And what is their function? They keep the lumen of the small airway open, particularly during expiration, when there is a tendency of these airways to collapse. If there was no elastic tissue to give radial traction during expiration, these small airways would have collapsed. So the function of the elastic tissues on the outside wall of the small airway is to prevent collapse and keep the lumen of the airway open. Now what will happen when there is increased amount of elastase or increased amount of oxidants? They will damage those elastic tissue, and that will result in collapse. The commonest site for collapse is in the terminal bronchiole, at the junction of the terminal bronchiole with the respiratory bronchiole, and that will result in something like this. And sometimes there will be the loss of the elastic tissue will be in the entire respiratory acini, as we have seen in case of Panacinar Emphysema. So always keep that thing in your mind. And now let's go deeper into the pathogenesis and look at this flowchart. So I have already mentioned the common causes of emphysema. They included tobacco smoking and congenital alpha-1 antitrypsin, which is an anti-elastase deficiency. So what will happen when a person is smoking? The tobacco smoke contains nicotine, and that is chemoattractant for neutrophils. So nicotine will attract neutrophil, that is neutrophil will accumulate, come out from the blood vessels, accumulate on the site, and they will result in increased release of elastase. Recall that neutrophil contains a lot of elastase inside them, and when activated, neutrophil can release those elastase. Okay, so that's the first mechanism. Tobacco smoke contains nicotine. Nicotine is attracting neutrophil. Neutrophils are coming and then they are releasing elastase. Okay, so that's the first mechanism. The second mechanism, as you can see, is tobacco smoke also contains reactive oxygen species, and that will activate some transcription factor named NFKB, and that will result in activation of genes that will encode interleukin 8, leukotriene B4 and TNF, and these things will attract more neutrophil, and neutrophil will come to the site and release elastase. And one important thing you have to know, neutrophil, when activated, they also release reactive oxygen species. So as you can see, I have shown you with this arrow, neutrophil coming, and then they are also releasing reactive oxygen species themselves too. And another mechanism that you can see, the reactive oxygen species can also result in inactivation of anti-protease or anti-elastase. So that will result in something called functional alpha-1 antitrypsin deficiency. That is, those patients did not have alpha-1 antitrypsin, which is an anti-elastase deficiency from birth, or they did not have congenital alpha-1 antitrypsin deficiency, but however, when they are smoking, the reactive oxygen species of the smoke resulted in inactivation of alpha-1 antitrypsin in those areas, and that resulted in functional alpha-1 antitrypsin deficiency. And as you can see in the bottom of the image, I have written, whenever there is congenital alpha-1 antitrypsin deficiency, since alpha-1 antitrypsin is an anti-elastase, and whenever there is deficiency of anti-elastase, that will result in increased number of elastase, and that will cause damage to those elastic tissue and result in emphysema. Not shown in the diagram, but you also have to know one more thing, that smoking also activates alveolar macrophages, and alveolar macrophages also contain elastase, and they also contain metalloprotease, and they can also damage the elastic tissue. So now that we have discussed the pathogenesis of emphysema, now we will move on to the next topic and discuss its clinical features. Now, one thing you have to remember, the clinical features of emphysema usually do not appear until at least 1/3 of the lung parenchyma has been affected. The classical clinical features of emphysema will include dyspnea, that is difficulty in breathing, barrel-chested patient, that is the patient will have hyperinflated lungs. He or she will also have prolonged expiration and will try to breathe through pursed lip. You know, the type of lip we see when we try to whistle or gently blow a candle. And the idea behind breathing through this pursed lip is it creates a back pressure, and that back pressure keeps the airway open, particularly during expiration, and that's how an emphysematous patient tries to breathe air out. So these are the common clinical features, and sometimes the patient may also give complaint of wheezing or cough, and that can confuse this disease with asthma, chronic bronchitis, etc. So now that we have discussed the common clinical features of emphysema, now we will move on to the next topic, and that is the diagnosis of emphysema. So how can we diagnose emphysema? Diagnosis is based on history, clinical features, and some laboratory diagnosis. So I have already mentioned the clinical features, and regarding the laboratory diagnosis, we will do chest x-ray, and we will also do lung function test. In the chest radiograph, what will be our findings? We will have 4 important findings in the chest radiograph in emphysematous patient. The first one is there will be hyperlucent lung field due to hyperinflation, and the second point in the chest x-ray is there will be increase in the anterior posterior diameter. The third point is the heart will be vertically oriented in the chest x-ray finding, and since the lungs are hyperinflated, it will depress the diaphragm, and so the fourth point that we will see in chest radiograph is depressed diaphragm due to hyperinflation of the lung field. Moving on to the lung function test, what will be our findings? So since the air spaces are enlarging in emphysema, so the residual volume of the lungs, that is RV, will increase. Okay, so the residual volume will increase, and that will also lead to increase of the total lung capacity, that is the TLC. Now what will happen to FEV1 and FVC? Recall that FEV1 means forced expiratory volume in the first second, and FEV1 will reduce. So FEV1 will be reduced, and so will FVC. But what will happen to FEV1 FVC ratio? And that ratio will also decrease. That means FEV1 is decreasing or reducing more than FVC. So when we are doing a ratio where FEV1 is on the top side and FVC is on the bottom side of the fraction, so the result will be lowered. Okay, so that is the lung function test. So I'm recalling again, residual volume of the lungs will increase, total lung capacity will increase, FEV1 will decrease, FVC will also decrease, and FEV1 FVC ratio will decrease. And that is an important hallmark of obstructive lung disease. Recall that emphysema falls under the group of COPD, along with some other disease like chronic bronchitis, asthma, etc. And so here, like the other obstructive lung disease, the FEV1 and FVC ratio will also decrease. So now that we have discussed the lung function test and chest X-ray finding, now we will move on to the last topic, and that is the treatment of emphysema. So how can we treat emphysema? Now recall that smoking was the most common cause of emphysema, so cessation of smoking must be the first thing to do, because otherwise the rest of the treatment won't work. So the first thing to do is cessation of smoking. The patient may be enrolled in some pulmonary rehabilitation program that will help him with the treatment protocol, and oxygen may be given about 1 to 2 liters per minute through nasal prongs when needed to maintain the oxygen saturation at 90%. Bronchodilators are also used. They include catecholamines in inhaler or nebulizer form, and although steroid inhalers are also used, the role of steroid in emphysema is controversial. And in your textbook you will see some other treatment options as well. They will include bulectomy, and in selected cases there may be lung volume reduction surgery, even lung transplant. And recall that Panacinar Emphysema resulted due to alpha-1 antitrypsin deficiency. So you may be thinking, then why not give alpha-1 antitrypsin in those patients? And the use of alpha-1 antitrypsin therapy is still under evaluation. So we are not sure what will happen if we give alpha-1 antitrypsin, as that thing is still under evaluation, but maybe in the future that will also be helpful. So this concludes today's video on emphysema. I hope this video was helpful, and for my viewers, if you like my videos, do subscribe and comment in the comments section below and let me know. So that's all for today. Hope to see you within a week or two with a new topic of pathology. And I will also try to post some additional image slides in my Facebook page to give you some more information regarding these topics. So until next time, take care and stay blessed. Thank you.